Hi, everyone. Thank you for joining the Center for Justice and Law today on this Spotlight interview where we talk about health justice and law. My name is Gao. I'm a student coordinator for the CJL at Hamline University. And here for our Spotlight interviews, we talk about immigrant and refugee health. And feel free to just send any questions once we have this posted. And today we will be hearing from Katie. And we've asked you to join us today because of your experiences connecting with our topic. You've helped a lot of the marginalized communities that are targeted by tobacco industries, and you advocate for them. And I think that's amazing. And it takes a lot of hard work and dedication, and I admire that. So we'll start off with the first question. Can you tell us about yourself and what you do exactly for the Association for Nonsmokers-Minnesota, and what brought you to this work?
Thanks, Gal, for having me. Brought me to Association for Non-Smokers Minnesota is the urge and the desire to make our community better. We're stronger together. I was really interested right out of school doing kind of something controversial and really wanted to impact the world and make it just a better place for all. I ended up at Answer or Association for Non-Smokers kind of randomly through a little bit of different funding sources, etc. I never pictured myself doing tobacco prevention this long, but I have, and I still love it every day. So really that dedication to improving our communities.
So the CJL focus is health, justice, and law, and the theme this spring of immigrant, migrant, and refugee health. So how does your work with Answer connect to these themes, and how?
Oh, I love health, justice, and law, and in my heart is also immigrant and migrant refugee health. First of all, I spent some time overseas when I was a little bit younger and didn't have children, etc. And so being in a third world country for a long period of time really gave me a really good grasp and vision of what it might be like in a new country, of just trying to navigate how do I get basic needs met and doing that. And I actually had white privilege in this country, so totally opposite. So um, even more praise and respect for all of our new Americans in Minnesota. So to how did this connect these themes? The tobacco industry has aggressively marketed for centuries young women, communities of color, GLBTQ, those communities that are so often marginalized, and they've done it, and they've done it well, and they have played a huge role in death and disease and disparities within these communities. Smoking also has a huge financial cost on Minnesotans and the nation and the world. In Minnesota, we pay over $3 billion in healthcare costs. That's almost $600 per woman, child, and per individual in Minnesota. That's a lot of money. I think that we would want to see our taxpayer dollars go to other great things that improve the community rather than paying downstream for what the tobacco industry has profited off of. And it just makes me furious and angry that they continue to profit off those in the margins. It's not right, and we need to call out their actions.
All right, so those other actions include like community-based tobacco prevention. So can you talk a little bit more about those community-based prevention and how is that important in your work?
Community-based tobacco prevention is really the key to our work. We cannot do policy change without the community at the table the entire step of the way. So community-based tobacco prevention could be working with the community to identify the problem, gathering research and data, talking with community leaders within each individual community or neighborhood or group, engaging those communities to like make a plan. Let's do something about this. Doing assessments, again, trying to document the problem, and then getting the community on board to educate and advocate to decision makers and ask for change. The community also plays a key role in implementing, maintaining, and enforcing these changes that we have been able to do. So the community is there every step of the process. They belong not just at one step, like I mentioned, they belong at all of the steps. I think as a community member, when I have a stake in something, when my voice is heard, I'm so much more invested in the work. I'm invested in my community. It builds stronger communities. Again, community-based tobacco prevention is key. Coming up from the bottom rather than top-down approach. Again, it's how we create behavior change and sustainable change for generations to come.
So we know that you've been collaborating with the course Health Justice and Advocacy at Hamline, which is the class that I'm in. So why was this collaboration appealing to the organization Answer and your tobacco prevention work?
The collaboration is critical, and it was very appealing. It is critical that we continue to engage young people in this work because they are, simply put, a target of the industry. I love youth advocacy. I see my job as rolling down the red carpet for young people so that their voice is heard. We can do that through tobacco prevention. We can train young people to how to reach out to decision makers, how to make sure their voice is effectively heard and advocate for change. We're doing that through tobacco prevention, but really these skills that I'm working with your class on and other young people in our community transfer. They can transfer to another issue in your life. And really, my goal is to really inspire you to make sure your voice is heard at every step of the process, not just going to the polls or voting or, showing up at the very end of the game, but have stake in your community and you can create change. And your voice is really, really important in tobacco prevention work.
So what role does health equity play in your work, or how have you integrated health equity into your work?
Health equity is the base of my work. Tobacco use, we know, like I said, disproportionately affects the poor, the homeless, racial minorities, LGBTQ+, and those suffering from mental illness and substance abuse disorders. We must make sure that those most impacted have a stake at the table. We must make sure that we can do all we can to make some of these roadblocks that we face easier. We must make sure that the healthy choice is the easy choice. I was reflecting on this question a little bit, and I went back to working on smoke-free air in Minnesota. So the time we did not have smoke-free restaurants and bars and bowling alleys. And those, yes, there's customers visiting those places that wanted smoke-free air, but really who was impacted by smoke-free air laws was the restaurant workers. Think of, being a server, working minimum wage, not feeling like you have a voice at the table, but being exposed to secondhand smoke for 8 or 10 hours a day. And not by choice. You needed to make a living and that was good money. And again, you should not be exposed to secondhand smoke. The other person I think about is our hotels. Think of working in a hotel, cleaning, who usually cleans our rooms. Those sometimes with, not other skills, but they're cleaning our rooms and they're exposed to secondhand smoke as they're cleaning rooms or thirdhand smoke. So again, making sure that those who are most impacted by this have a seat at the table, and we can do all we can to protect them. Another example is at Answer, we have a program called Live Smoke Free. And our goal is to make sure that those living in multi-unit family housing are not exposed to secondhand smoke. We get calls regularly from tenants saying, I am disabled, I can't leave, I have to be in this building, but I'm exposed to secondhand smoke 24 hours a day. I couldn't imagine. I couldn't imagine trying to raise a child in that who has asthma, or I already have other health issues, and being exposed to secondhand smoke. Going on a little bit to the point of sale policy work, I think of sometimes, I think there's a lot of talk about food deserts. Food deserts occur sometimes intentionally. And we also, relating that back to tobacco, we must make sure that cities don't allow tobacco shops to, infiltrate communities. We did some research a number of years ago where we looked at locations of tobacco stores. We found that there were more tobacco stores in communities with high African American residents and low income. In Ramsey County, we found that there was a lot more tobacco stores along University Avenue, Snelling Avenue, Roseville, that first ring, Maplewood, that first ring suburbs. But you get out to North Oaks and Arden Hills, they don't have that. And you can lay a census data right over those two maps and see that correlation. So again, we have to do health equity work. We have to do this work. It has to be the base of our work. So again, in tobacco prevention, we're looking at reducing disparities amongst groups that are most affected by tobacco use and secondhand smoke, addressing factors that influence disparities. So again, not having a place at the corner where a young person can go and buy tobacco products pretty easily and price, and then building that support through diverse community partners. Does that answer your question?
Yes, that's very helpful. That's a lot of good information. Like, I totally agree. Like, I feel like it's not fair that a lot of like people and like workers, they really don't have a choice because what they're doing in their environment, like working or taking care of their children, like they don't have any other choice but to be there because they can afford it or um like that's their life. And so I think it's important that you're advocating for people that has voices that needs to be heard.
And they're sometimes scared to use their voices due to immigration issues, or just again following that American dream and not wanting to put any roadblocks between them and their supervisors. Or again, this absolutely has to do with law and health justice. And if we can create laws that protect everybody, not just some workers, we succeed.
So what are you most excited about in the work that you're doing, and
Oh,
what's giving you hope?
what's giving me hope? Working with young people. I love you all. I love working with young people. I'm really inspired by young people, and you just being willing to speak up for things that you don't see as right. Being able to share your voice and your experience, and really asking for change. You can go to a city council meeting, or you can go to the Capitol, and when older lobbyists testify, it's just not as powerful as when a young person comes in and shares their story about how flavored tobacco has influenced their family. You have a colleague, you have not a colleague, a former student or a coworker or student, what would you call it? Classmate, sorry, that has a great story, and you can't argue with that story. You can't. There's nothing to argue about, and other than feel called to act. In one of our meetings yesterday with elected officials, we were told that they said some of the pushback they got on the flavors bill was that it was racist. And I can bet you that someone saying that was trying to scare this elected official. By not doing something is racist. We must act. We must not continue to leave communities behind in our work. We must work together. So young people, you just inspire me. You bring me joy. When I see you have success and feel that you're heard, I just like, yes, you can do this, and do it again. And I've seen that in my work of people saying, oh, I was scared to do this, call my elected official or speak at a meeting, but now I can do it on a whole bunch of issues, and I've seen just the growth, and I love it.
I want to add another side question. So what would be your advice to like all the young people out there trying to advocate?
Yeah. I think, oh gosh, your story is your own. Don't feel that you have to be an expert in something. You have to have all the facts down. You have a story, and that's what's most powerful. Being able to share your story in an effective way is really important. Sharing your story and then asking for change is really important. My other advice is don't burn any bridges. I see a lot of young people that we get angry about something and we don't get something right away, and we feel like we've lost the vote, or we just can't make changes, too hard. But in my career, I've been able to see people or elected officials that have not always agreed with my issue at the time, but come back 5 years later, and they're the best advocate. So being able to respectfully disagree, and just bring that person along on the journey and continue to those conversations. Just don't be shut down by someone who doesn't agree with you right away. Just continue those conversations. And I think that's so important, especially where we're at in the country, is that we need to have tough conversations. And if we don't, we're in trouble. So being open to listening and hearing, and what do you need to bring you along, and what do I need? And don't be scared to make sure your voice is heard.
So going back to the work that you guys do, how have you been educating communities and workers about tobacco prevention? And like, what methods do you find most effective?
We've been working with community partners since I began years ago. What we usually do and what has been effective is to we pay, or we give stipends to community partners who can kind of join us in this work. So through that model, we have been able to build a really successful coalition. Everyone is valued at the table. Not the staff just aren't getting paid, but everyone is getting paid or getting a stipend to be there. I think that's super valuable in, especially in diverse communities. That you guys, they haven't already have enough on their plate, and we can't expect them to volunteer for things. And I feel the same way for young people. We must pay young people and engage you the same way that I would want another adult there. So I think that's really important, is building that coalition. And then, through our coalitions, we're able to reach just so many more people, because each member of our coalition has their own network. So coalition building, community engagement through, we've done events, we've done festivals, we've done, again, speaking opportunities. We're doing social media, and again, just talking to people. The more, if I can talk to 3 people and then you can talk to 3 more, it just spreads. And that has really been effective in building capacity, and our coalitions that have really done the heavy lift of creating change in our community.
And so, what is your call to action? Is there anything else that you want people to know about tobacco prevention?
Yeah. We sued the tobacco industry years ago. The state of Minnesota sued the tobacco industry as a landmark case. We were one of the first to do it. And a lot of things came out of that, but people needed to take risks, and it was really bold thinking at the time. We're at another place in our history that we need to call the vaping industry. They're using the same tricks the tobacco industry did in the 50s, 60s, and 70s, and hooking a whole new generation. We just can't wait for somebody else to do something. We as a community need to stand up and say enough. We don't want this in our community. I think so many times I hear people say, oh, the state's going to take care of it, or the feds are going to take care of it. We can't count on it. We have to take ownership of our own community, and we must act. So my call to action today is, if you live, contact your city council members, contact your school board, and say that flavored tobacco doesn't belong in our community. There is no role of that. It's doing nothing but making the tobacco companies rich while profiting off the backs of those in the margins. So don't be afraid. And you don't have to get the points down, but you need your voice to be heard. And don't be afraid to call up somebody and say, or send an email and say, this doesn't belong here. I don't agree with this, and please do something about it.
Well, thank you so much for sharing all of that with us today. I think it's really important to have voices be heard. Um, and I really appreciate the knowledge and experience that you're willing to share, and also your dedication and hard work for the community. And then for everyone that is watching this later, make sure to follow us on Facebook and Instagram. We will have another spotlight next week, so make sure to keep an eye out for that. And thank you all for watching, and I hope that we get to see you all again next week.